communication skills, unless they like want to add a case, and we can talk in iambic pentameter, but not usually a big communication thing for us. So thank you for having us up here. So Kim and I started our journey with PQI almost backwards. I ended up being invited along to an SQI course through Michelle Goki, who was working on just a way of localizing non-palpable lesions for breast through seeds. And anyway, she had invited myself, Francis Z, and Marty Heed along. And so we ended up in a weekend going to this place and talking about this, and we showed up there and I was just like overwhelmed. I'm like, who are you people? Like, you guys are totally organized and there's a structure and there's a plan, and Ta was there and Janice was there, and I was like, what is this? I want to do this. Like, so I was participating with Michelle, and I said to Janice, I want to do SQI, I can find something to talk about. And she's like, well, what would you like to talk about? And I said, well, there is this disease that's becoming more prevalent for breasts that does not seem to be acknowledged or recognized, and people are going down a pathway of getting inappropriate and long-term treatment, which really needs to be backed up and addressed. So I said, I'd like to be SQI. She's like, no, you can't. You can't be SQI, you have to be PQI. I'm like, okay, I'll be PQI. What's PQI? So it was, for me, a bit like, you know, Alice in the Looking Glass. I had no concept of, I hadn't even heard of PQI before, and I've been a surgeon for 25 years. But so she's like, okay, this is where you start, this is where the levels are, and I have to say, I am just, it's like a grassroots movement of people who are enthusiastic and organized, and there's a structure, and it's actually been really lovely to participate in, because there was no inventing the wheel here. It was just adding our problem to a well-established wheel and coming out the other side with definitely a change to what we were trying to address. So Kim and I, so we work at the breast clinic at Jimmy Pattison, and there's a disease called granulomatous mastitis, and we used to see this disease about maybe once a year, 2 times a year, and it's actually quite a horrible disease. It's an inflammatory condition of the breast where people just start for no reason fistulizing everywhere, and it's a maintenance issue, and it looks horrible, and the patients are freaked out, and everybody thinks they have cancer, and they end up in the emergency room multiple times getting, you know, different investigations, different treatment, multiple courses of antibiotics, but really it's not an infectious problem. And so we used to see it about maybe once or twice a year, and all of a sudden we were seeing it 50 or 60 times a year. And I said to Kim, what's going on here? This is really bizarre. And so we actually grafted, and we could see through all the Fraser Health the curve of GM going up. And just to a backside, we're wondering if it's maybe a post-infectious thing, because we can see the blip after COVID. We could also see a tiny blip in 2015 after H1N1, but nonetheless, this is what it is. And so we had a patient one day, we had a hospitalist one day actually call us up and say, you know, we needed a breast patient to the hospital for a month, and we just can't get on top of this problem. I thought to myself, a month for an admission for a breast patient, this is crazy. So when she described the condition to me over the phone, I'm like, well, you got a GM. And she's like, I'm a what? I said, this patient's got GM. She's like, no, never heard of it. I'm like, okay, just discharge the patient, send her to the clinic, we'll deal with it. And then I realized, okay, this is a condition that is something that a lot of people haven't even heard of, so how can you treat it appropriately if you don't even know about it? So that ended up being our PQI project. And through Sarah Osler, who was our sort of person overseeing it, and Janice, who, my God, is a lifesaver. If you ever get a chance to work with Janice, do. It's lovely. There she is. She should be running Fraser Health if anybody's interested. She is so organized and so wonderful. Anyway, so we were able to actually take all these patients and do a massive chart review and figure out where the issue was, and then do our PDSA cycles and do interventions. And a lot of it was education. It was education to the emerged physicians. And we actually did a little monkey survey. We learned so much. We learned so much about statistics. It's like Greek to us at the beginning. But anyway, we did a little monkey survey about, like, do you know GM or what is GM? And they were like, no, we have no idea what this is. And then we gave a little talk. And then they're like, oh yeah, we've seen this. We just didn't know what it was. So we just keep treating with antibiotics. We're like, yeah, we know, you gotta stop that and actually diagnose this and treat this properly. So it ended up being great. We were interacting with the emergency physicians, with the GPs, with the radiologists, because it's become something that's now so common you can diagnose and radiology, and then with patients. And then on to the next step of treating it. But we were able to actually really see that this was something that we could plug into the structure that PQI has showed us what to do with this, and then out the other end, see a difference. And so it was an amazing experience. And with this, we were so excited about it. I said to my anesthetist one day, I said, Brenda, you wouldn't believe this. This is great. This is the PQI thing. And she's like, what? I'm like, yeah, you got to sign up for cohort 12. And she's like, okay, I will. So, and then, so just if you have an opportunity to actually share with the people you work with, many people don't know about PQI. They really don't. And once you actually start just taking a few minutes to say, this is kind of what it's all about, and this is what we did, they're like, oh my God, I got something I would totally work with that. And so it's just sort of a matter of getting out your experience and exposing other people to it, because that's how I got involved with it. Michelle said, I got this SQI project, would you come on board? I'm like, sure. And then this is where it's led. So it's been a very valuable experience, and if you have an opportunity to share this with some of your colleagues who may be interested, it's a valuable opportunity. Yeah.
I just wanted to say, because I'm a nurse, not a physician, so it was sort of the best uninformed decision I've ever made in my career. Rhonda just went, hey, did you want to do this? And I'm like, okay. Just because she asked, I had no idea what I was signing up for. But I'm pretty thankful for it. And what I sort of learned along the way is physicians and nurses think different and we approach things differently. But I think that's what made us a really good team, was because Rhonda had the clinical knowledge and I kind of had a little bit of like the process and who to talk to go to what. And so that's, I think, so team building wise, I think it's really important to bring in an invested nurse or invested manager type person that to